Welcome to Deep, the health marketing podcast. I'm John Mangano. Lately, I've been thinking about something. As consumer marketers, we focus on helping patients become aware and treat their conditions. And as HCP marketers, we focus on helping providers learn about the benefits of new treatments. And in the end, we have faith that reaching both sides of the patient provider continuum will drive the improved health outcomes we are targeting. As an industry, we are rarely managing the campaigns together, which is crazy because ultimately both patients and their providers need to be aligned on their care. So today, I want to go deep on how the industry can holistically market patients and providers, and have invited a special guest, someone who has pioneered doing just that, creating ways to market to patients while they are researching their care and providers, and marketing to providers when they are going to see those patients. I'm speaking of none other than Mukund Jain, a pioneer in marketing across patients and providers, who, in his latest role as Senior Vice President and General Manager at RVO Health, has invented new ways to integrate marketing. Welcome, Mukund.
Hi, John. Thanks for having me.
MJ, you have a unique profile for our industry. You've had a very rich and diverse career in healthcare, touching different stakeholders in your career voyage. Most of our guests started as marketers and found their way to healthcare. You started in healthcare, advocating for patients from the start, and found your way to marketing. Tell us about your career voyage.
I've always been interested in healthcare, going all the way back to college. I studied biomedical engineering in undergrad and grad school. Worked as an engineer, modeling a lot of clinical pathways, and then ultimately worked as a marketer at an organization that sold products and services to health systems, hospitals, and long-term care facilities. I recently joined Healthgrades, recently being 15-ish years ago, where I started helping hospitals drive more appointments, and then moved over to the media side where really supported direct to consumer as well as healthcare professional marketing.
Ultimately, you're a builder at heart. So, as marketers, we tend to kind of create campaigns to derive a specific goal. You're ultimately building and architecting the underlying pieces to connect the patient and the doctor, and then attaching the marketing to that, which I think is a very different way to view the industry than probably most of us on the marketing side view it. So, you've worked across both HCP and DTC sides of the business, which not a lot of people have done. What made you start thinking about connecting those two worlds?
So this is kind of the context for it. So the exam room interaction, the moment when the patient and the physician are, finally sitting across from one another, is where every dollar of pharma marketing either pays off or collapses. I look at it as the crucible where clinician or clinical credibility meets human emotion. And yet, unfortunately, it's often the most neglected point in the brand journey.
Yeah, really, that magic moment is when everything comes together. What is happening in that moment that marketers tend to overlook?
So I think they underestimate the complexity of what transpires in that brief dialogue because there are competing priorities. There's asymmetry of knowledge and information, and there's unfortunately a great time constraint. The patient is going to bring anxiety. They're going to bring fragments of online information that they've collected through various sources, and very selective recall of claims that they've seen in advertising. The physician balances empathy with efficiency because they have to get to the next patient, and they're constrained by reimbursement rules. They're constrained by clinician or clinical evidence, and what's missing is alignment, right? Whether both parties have a shared understanding of the disease state, the treatment rationale, and what the next steps are. And unfortunately, when marketing, overlooks that dynamic, it can create this cognitive dissonance because, a beautifully executed consumer ad campaign might prompt a request. And that's what they want. That's what that team wants. But that request feels misinformed to the clinician because they may not be prepared for that moment. And it undermines the, trust rather than fostering the action that marketers want to promote.
It seems like no matter where you are, whether you're in the doctor's office or at work, or even as a father of a teen at home, when the listening stops, that's when things go sideways quick. And if a patient is talking to a doctor and the doctor's already dismissing what the patient is saying because it's that ad again, um, or the patient is not listening to the doctor because the patient is thinking about something entirely different than the doctor's talking about, that's where it goes sideways. And is that the point to which, as marketers, we need to focus the most on?
Yeah, I think that's exactly right. I think effective marketing has to act as a translator between that emotional motivation that the patient has and scientific validation, which is sort of the mindset of the clinician, right? And there are several strategies that I think marketers can do. First and foremost, I would say, you know, shared language and framework. So there's inconsistency in the lexicon and some of the visual cues that I see amongst the DTC and the HCP materials, right? First and foremost. You don't have the same concepts and the same things appear in both environments. And when a patient uses a term, like I'm going to see an ad today and I'm going to say something to a doctor tomorrow, right? And because I've seen it and it sort of resonates, which is great, the clinician immediately has to recognize that context, and that doesn't happen.
Well, and it's interesting too because I would say in most cases the driver of that communication and the mindset is very different. I would say with a healthcare provider, they're in a non-emotional clinical state, factual scientific state. For most conditions, the patient is coming in with probably a much more emotional response to the condition, whether they're just being diagnosed for something for the first time or they've just been in pain where they're scared what this means. And that conversation between the patient and the doctor could take very different turns or even have different reactions to the exact same thing that's being said.
Yeah, that's exactly right. And I think that's where both parties have to come to the middle at some point. And I think consumers, just because they're bringing such an emotional lens, it's hard for them to move, right? Whereas the burden really has to be carried by clinicians, and we have to provide, as marketers, we have to provide clinicians with, concise, compliant discussion aids that can really help meet the patient at the moment and at the place where they are. And they have to anticipate the exact sort of misconceptions or the questions that DTC campaigns are going to generate, which is kind of what they're intended to do. There's a reason why we ask consumers to ask your doctor if such and such is right for you. But the doctor has to be better prepared to, address some of these questions, and that's a burden that marketers carry.
I'm not sure the emotional part, the emotional response that the patients have is a bad thing. If we're trying to get patients to take care of a condition that they might ignore otherwise, that could, you know, create a lot of health problems or, even cost them their lives. Emotion is good.
So, as marketers, we have to provide physicians with concise, compliant, discussion aids that can really anticipate the exact misconceptions or questions that DTC campaigns are going to generate. There's a reason why we ask consumers to ask their doctors if such and such is right for them. Right? That piece of marketing is doing its job. It's provoking consumers to ask the right questions. We have to make sure that we're arming clinicians to meet the patients at that moment.
So there has been somewhat of a great divide. When have you seen great work on one side, where on the other side, whether it's a DTC campaign that just didn't deliver on the message the way the HCP campaign did, or vice versa, that in hindsight might have been done differently and driven different outcomes?
Most of the time, unfortunately, you have one team who's really struck the chord with the intended audience and done a great job of mobilizing that audience to take action or to be prepared for the other party. I think more uncommon is where both parties are aligned, both parties in terms of DTC marketers or DTC marketing or HCP marketing, and there are certain brands where they've really aligned their HCP and DTC storytelling through through areas of connecting that care and ensuring that physician messaging about patient empowerment mirrors the emotional tone of the consumer work that's actually been done. But that happens very rarely.
It feels like we're comfortable with keeping things in silos. Like, as an industry, we tend to do it even though a lot of us recognize that aligning closer would be beneficial. Why is that?
I think I think it has to do with habit and some organizational inertia. Um, and it's also cultural and psychological, right? So pharma companies are inherently very risk averse. They've got layers of compliance oversight. They've got conservative hierarchies. These structures favor control. They favor specialization rather than integration. And additionally, I'll say the metrics of success differ, right? So for HCP marketers, it's all about script lift and it's about formulary inclusion and that kind of thing. Whereas for DTC teams, they focus on awareness, intent, patient activation. So if you're not, unifying KPIs and strategic ownership, collaboration becomes an option versus a necessity, unfortunately.
So you've been at the forefront of this. Walk us through what actually doing it in practice looks like.
First and foremost, what I would say is you got to have strategic alignment. And I'm not talking about structure, right? Unify the brand narrative. You have to have a core value proposition, one singular core value proposition that resonates both clinically and emotionally. And then you have to adapt it to both audiences, whether it's consumers or whether it's clinicians, rather than developing separate campaign platforms. Um, you can have joint planning sessions where you've got an HCP team and you've got DTC teams co-creating that brand journey from awareness through prescription through adherence. Um, and really tactically speaking, right, you've got tools at your disposal, such as I've seen it done really well where you've got journey mapping or message architecture that exercises, or message architecture exercises that really expose the overlap and some of the interdependencies in the messaging in both audiences. And that shared process is gonna really be instrumental in surfacing redundancies, contradictory claims, and missed opportunities for reinforcing, especially at that magic moment where patients and clinicians come together.
And you mentioned something, right? We have more tools than ever before. The tech is so much better at connecting the dots, all still in a HIPAA compliant way, but in a way that allows us to understand reaching patients and reaching clinicians and what that cumulative impact is. What do you tend to see when that does happen? What kind of impact are our fellow marketers seeing?
I think when that happens, especially with the tech, you have alignment, strategic alignment. Certainly, you have emotional alignment where consumers are making that, bringing a full, complete knowledge of whatever that condition is and whatever that treatment optionality or options are to the forefront. And you have clinicians who are very sensitive and what they have in front of them is a very informed consumer and patient rather, and they can align with that consumer both in terms of the treatment, but also what that future state is going to look like for that consumer. And I think when you have that and you have that orchestration done properly, it really ensures that it want to give clinicians the satisfaction of being a clinician. It's especially important in this day and age, and consumers the importance of actually being heard, which is something that's lacking in consumer health marketing.
So I appreciate that, but as you know, I am an analytics wonk, and usually when clients come to me, they want to see incremental scripts and ultimately activity that shows improved outcomes and improved ROIs in the campaign. If I can say it, um, are the KPIs aligned there between HCP campaigns and DTC campaigns, or do the measurement companies out there even have a solution that helps quantify that?
Unfortunately, the KPIs aren't aligned because structurally you've got a DTC agency that's focused on DTC KPIs such as brand awareness, intent, and activation, and you've got HCP agencies that are focused on script lift and engagement with um, uh, HCP marketing or advertising elements. And so, where because you've got that structural limitation and you've got two different agencies at work, and oftentimes those two agencies might be the same agency, but it's two different teams, right? You've got misalignment there. It's hard to get that KPI alignment.
So, what advice would you give if a listener is someone working at a brand or even in an agency and they're saying, well, my world is so siloed. How would I start to bring these worlds together?
I think you have to anchor everything and everyone around that shared moment of care. Every piece of content, whether it's an ad, a rep detail aid, or um, patient email, or even clinician emails, they should all be measured in their ability to make that physician-patient conversation more productive, more aligned. And that means unifying data flows, harmonizing language, and building empathy into both sides of the journey, which is very hard to do. The most successful marketers are not going to think in terms of HCP strategy or DTC strategy. Rather, they're going to be thinking about, okay, well, how do I how do I create decision support design that really meets both parties, and making sure that that 8 minutes that you have where patients and physicians interact are really truly impactful.
So then where is all this heading? In a few years, I mean, there's of course always change in marketing, not just in pharma marketing and healthcare marketing, but marketing in general. We have tech that's dramatically changing. We have a pharma environment through legislative and privacy and other forces that are changing. Where do you think this will all be in 5 years as those changes take place?
I think the trajectory of pharmaceutical marketing is going to converge, right? You've got two binary sort of tracks with HCP and DTC, and that all is going to converge, and it's going to be more integrated in a very integrated ecosystem. It's going to be defined by a lot of shared data and synchronized messaging and seamless, digital experiences. You're also going to see a lot of personalization and AI enter into this connected approach, and personalization is going to serve as that connective tissue in this new world where both sort of paths are converging. But AI is going to be a game changer in the sense that it's going to enable real-time tailoring of content that's going to be based on behavior, demographic, and context. And that's not just going to be for patients, it's going to be for HCPs as well. So I'll give you an example. Predictive analytics is going to determine when a patient is most receptive to disease education content. So is it when I watch Jeopardy with my 15-year-old, right? And it's also going to tell me when a physician is going to be most likely to consider a new therapy. Is it going to be during lunch, or is it going to be when I'm back in front of an EMR and during my notes? Natural language processing is going to be very effective in aligning that search behavior and the professional discourse that's going to happen. And it's going to make sure that patients, what they read online is compatible with what clinicians are learning in CME activities and their various portals. So AI driven insight engines are going to change in the next 5 years. I think in the next 1 to 2 years, change how that magic moment happens, especially when we're going to match patient intent with HCP readiness, which I think is really at the heart of what pharmaceutical marketing is going to get to.
Yeah, I don't think people realize the degree to which measurement occurs or that it occurs at all, and the degree to which customization in a HIPAA compliant way um, is possible, which ultimately means better health outcomes. I was watching the World Series with my daughter, and there were a lot of pharma ads, and it made me laugh when she looked at me and said, "Do all these pharma ads really work?" And I just kinda looked at her like, "Do you know who you're talking to? This is what I do day in and day out." And if my own kid, doesn't understand how the industry works, I just can't imagine, anyone, outside of the industry understanding the value that we are building to provide patients with this information and healthcare providers.
Yeah, I think we're about to enter a whole new world with AI and the level of personalization, right? You can imagine a world where you might be watching the Blue Jays play the Dodgers, and it might speak to you directly, and it might say, "John, you may not realize you've consented to this somewhere, but it might say, John, for that XYZ condition, pay attention to these ads or look at this particular ad because it might change your life." And it might know that, hey, you're based out of Virginia, and there's a particular doctor who's ready to, or your PCP, and can see the same message and make sure that he or she is prepared when you go visit them.
How does that maintain HIPAA compliance, though? That would be the concern I have, and I would expect we would have to, defend against.
The HIPAA compliant question is a good one. I think um, it's something that regulators are going to have to grapple with uh, seriously, because as we navigate through various digital platforms, whether it's our phone, whether it's connected TV, we're leaving breadcrumbs behind. We're leaving information behind, and there are a lot of organizations that are stitching things together. For example, I could be on a diabetes website or a brand website, uh, and be perceived as having diabetes or being a caregiver to someone with diabetes, and that could get stitched with something else. And then I could see an ad for a diabetes brand while I'm watching the Blue Jays play the Dodgers, implying that I might have diabetes. Um, and that could carry forward. But whether or not I have given or consent to someone letting them know that I have diabetes is irrelevant. The very fact that they're looking at these different breadcrumbs and improving the odds, which is all I think what marketers are doing at this point in the journey, improving the odds of my likelihood of having diabetes versus someone else, is that's the game that they're playing. Is they're just barely improving the odds, and that's going to be enough for them.
So, any final thoughts when, you think of our listeners, for 2 groups of listeners? First, those who are marketers, who are building plans, on how they can market to HCPs as well as to patients. What, would you leave for them to think about?
I think ultimately it's all about the patient physician interaction, those few moments that both parties have when they're interacting with one another. And bridging that moment requires empathy for both sides. Understanding how patients can articulate hope, how clinicians process evidence is really important. And marketing that equips both sides to meet one another halfway. I think it's going to transform the brand from a message to a meaningful exchange.
And I think empathy probably is in short order in today's world, so, we could all focus on empathy. Second question, and I think where you find the empathy is in the world where there are people like you who started their career, not as marketers, but looking to solve health problems as biomedical engineers, as healthcare providers who may want to go into marketing, uh, and the marketing world that we live in. What advice would you give them?
I think being in healthcare is a very noble profession. When you can make, especially because we all are humans and we all have to deal with health issues, whether it's for ourselves, our children, or our parents as they age. So we're all touching health. And if you can do something in your professional life, what you do in your personal life as a caregiver and as a caretaker of yourself, I think that alignment is very rewarding, is very fulfilling. So if there's someone out there who's interested in getting into biomedical engineering, or someone who's interested in getting into healthcare marketing, I encourage them to pursue that because it's really going to be very fulfilling and rewarding at the end of the day.
And it's never too late to make the switch. I think we all underestimate the value of our experiences and how experiences outside of whatever it is we want to move into actually make us better at what we want to move into to begin with. Mukund, thank you so much for joining us.
Thanks for having me, John. Congratulations on your success. It's a pleasure and honor to be here with you.
This has been Deep.